allow enough of us who are going to get mild illness to become immune to this, to help with the sort of whole population response, which would protect everybody.
Yeah, I mean, that herd immunity, I know you talked about yesterday when you were appearing with the Prime Minister. In terms of building up a herd immunity within the UK, what sort of percentage of people need to have contracted the virus?
Probably about 60% or so. And we think that this virus is likely to be one that comes back year on year, become like a seasonal virus, and communities will become immune to it. And that's going to be an important...
This was one of the science advisors in the UK government. The UK government's initial policy for COVID-19 was basically herd immunity. Let the weak die off. Boris Johnson went with that policy up until the point where Boris Johnson himself got sick, realized how bad it was, ended up in the hospital looking pretty bad and embarrassed. And this was long before Donald Trump got sick, got out of the hospital, and the policy of the government basically changed. It changed because it had to change. They realized that this was far more significant and far worse than what they realized. They ended up in a situation where the hospitals were being taxed. You can look at Spain, you can look at Italy, and yes, you can look at the United States. Right now, our hospitals are being overly taxed. Yesterday, there were, 3,600 people that died from COVID-19. I remember when I was doing these videos, and I would make the point that there was 1,000. There was 2,500. I remember even predicting at one point that there were going to be 2,500 people that died from COVID a day, because you can kind of see where it was going based on the numbers. We are at 3,600. The President of the United States is basically acting or pushing to try to overturn the results of the election to get a job that he is currently not even doing. In the UK, Boris Johnson, at the very least, is trying to attend to COVID-19, is putting in certain restrictions or whatever, whether or not those things have been all that much productive because of where it started. The thing is, in the herd immunity stuff, the more people that get the infection, the more people that end up at your hospitals, the more people that are spreading this stuff around, the more people invariably will die. But also, the more potential it has for the virus to mutate. And that's what has taken place in the UK. There's a new variant of the COVID-19 virus that is basically moving through the UK. And it's moving through areas where they're seeing an uptick in the virus and the rate of infections. So this, UK, but you can see they're also seeing these spikes. Yesterday, let's see, there were increased, let me see, UK deaths, I think there were 232. A further 232 people died from coronavirus, the government shows. Another 20,263 cases have been reported. Earlier, Health Secretary Matt Hancock revealed that a new virus had been found. Now, the numbers don't seem extreme, but keep in mind, their population is much, much smaller than ours. I think they have like a sixth of our population. So for the numbers, especially in comparison to size, in comparison to the surrounding area, it's not good. Infections have climbed dramatically in London and South East, with rates rising across each local authority area and in the capital 7 days to December 10th, and the highest number of hospital admissions since April. Keep in mind the problem. If hospitals are jam-packed, how do you accommodate the other cases? And assume for the moment that the hospitals are jam-packed with people with COVID, not the infection rate and everything else. The chances of the doctors, the chances of the nurses, the chances of the staff getting infected increases. The hospital over here that I go to, when I ended up in the hospital with COVID, all of the procedures had to change. Guests couldn't come and visit the people unless there was some kind of dramatic illness associated with it. They lie to you. At least that's the policy that they took with my wife, basically lying and saying, yeah, we'll put this through, when there was really no process to ever put through. But that's the stuff that they're doing in order to try to deal with the fact that people can't visit their loved ones. Doctors, nurses, staff All of those things have to be done. The patients that are not sick have to be made sure that they don't get sick. It adds a complexity to all of these levels. And so if you get a situation where your hospitals are jam-packed, what about surgeries? What about other people who need to come into the hospital for other issues? Let's say cancer, let's say diagnosis with other illnesses and diseases. All of that stuff get pushed to the back burner, which is why the whole point was not herd immunity, not let the weak die off, and to try to manage the number of people who ends up getting sick. The new virus has a different structure, and the thought is, or the question surrounds whether or not the new structure is contributing to the increase of infections. Now, in the United States, our increase of infections is because nobody's really paying attention. Donald Trump has abdicated all responsibility, I suspect, on some level, is even punitively letting the country just burn. Pelosi, Democrats, they're kind of checked out of it. And you might have these local governments and everything else that's trying to make do. But those local governments are basically in the various specific areas of the country. And you may have different levels of attentiveness and people migrate. So you don't have this situation that people who are in one particular state only stay in that particular state and they would only be affected. And it doesn't work that way. It's spreading here. Right here. So the mutations include changes to the important spike protein that the SARS-CoV-2 coronavirus uses to infect human cells. A group of scientists talking about the genetics of the virus said, but it's not yet clear whether these cases are making more infections. So they're seeing an uptick and they're seeing a spike in the infections in various areas, especially in areas with this one. And they see a structural change to the virus itself, but they're not sure entirely whether in structural change what it means. Meaning they don't know entirely if that's increasing the rate of infections. They don't know if that has an increase for the rate of death. They don't know if this is making the symptoms any particular way different. They don't know. Science in action. A new variant. Efforts are underway to confirm whether or not these mutations are contributing to increased transmission, the scientists from COVID-19 Genomics UK Consortium said in a statement. The new variant, which the UK scientists have named VUI 2020112/01, includes a mutation in the viral genome region encoding the spike protein, which in theory could result in COVID-19 spreading more easily between people. The British government on Monday cited a rise in new infections, which it said may be partially linked to the new variant as it moved through its capital and many other areas into the higher tier of COVID-19 restrictions. I know people don't want to shut down Christmas, but at this point, the UK may have to. As of December 13th, 1,108 COVID-19 cases with the new variant have been identified predominantly in the south and east of England, Public Health England said in a statement. But there is currently no evidence that the variant is more likely to cause severe symptoms or severe infections, or that it would render the vaccines less effective. Both are up for question. They don't know. So think about it for the moment. There's a new mutation, which we knew was going to happen at some point. That mutation potentially is more infectious, at least by the structure and the look of it. It is unclear whether that more infectious virus is worse. Meaning, even if the transmission rate is higher, it doesn't necessarily mean that it's worse symptoms or that the people have a higher propensity to die or a higher propensity for comorbidity to be affected after the fact. They basically are in a situation where they don't know. The vaccine just came out and they have to assume that it still works on this new strain. This is fascinating. This is utterly fascinating. Like, we knew that this was going to mutate because the flu mutates and we know viruses just kind of do that. But the herd immunity thing, this kind of undermines, I mean, granted, the argument had been undermined prior, but the propagation or the potential for viruses to mutate should give pause to this idea of herd immunity. And there was a mutation in this virus once before that had taken place. This is not the first. And the question becomes, does any of this get to the point where it mutates out of the range for the vaccine, where it mutates out of the range where the vaccine doesn't necessarily work as well if it works at all, and gets more infectious, or for that matter, more deadly? Stay tuned. Stay tuned. The vaccine is Flint water. Don't say that, Michael. Don't say that, Michael Wibbs. The same is updating your computer with virus updates. Yeah, I mean, the thing is, they would have to... Look, I am one of those people who... I don't want to take the vaccine unless I have to. I don't like injecting myself with stuff like that. And for all of the stuff that have taken place in a very short period of time, to be honest, they wouldn't allow me to take the vaccine anyway. The comorbidities and stuff like that, they haven't tested it with all of these things. The odd thing is, the people who actually need the vaccine are the ones who they haven't necessarily tested it for yet. But I guess the thought is herd immunity. If you get a lot of healthy people that have the vaccine, and those people are mingling about, at a certain point, the other people who, let's say, are weaker or have comorbidities may not have to get that vaccine if the other ones are healthy. I don't know. Yeah, I don't know. All right, I'll leave this here. Like, share, and subscribe. Thanks all. I will, try to get one more in. Thanks all. See you in a few.